My client previously had problems in flexion, so that was restricted. So the motions I went through was hands on the front for me and then reach down as far as you can. Good, so at this point we got to a certain point and this is when they generated some pain through their lower back. So now I'm just going to go through a little bit of palpation and see how it is and whether or not there's any tension through that lower back and where specifically it is sore. But now we're just going to go through a couple of functional motions. So if I can get you to have feet shoulder width apart for me, we're going to go down into a squat. I just want you to go down to where you feel comfortable and then come back up for me. If I can get you to move your feet slightly wider for me and we'll go into a slightly wider sumo squat. And then if I get you into a lunge position, one treatment method we're going to use is a bit of a trigger point into the sensitive area. We're just going to apply a slight pressure and get a little bit harder each time. So we're going to go through some range of motion and movement work to try and improve that flexion now. So we're going to use a flexion driver. So if I can get you to have your hands on the wall for me, and then all we can do is we'll go with the right leg first, is just bring that right knee up towards that chest for me, as best as you feel. Good, let's progress it on slightly and let's try and, as you bring that knee up, all you're going to do is bring that head down towards that knee for me. Good, so here we'll just get a little bit of load into that top of that glute, into that lower back, trying to help desensitize and start loading that back up as best as we can. So that was a few bits of our assessment and treatment that we would do in a normal clinic situation for a lower back problem.